Right, so a few days ago, the SDO of Meme Division sent out an announcement informing the general public that there was an outbreak of a certain disease, schistosomiasis, and that people should do this and do that. I was okay when I read the document. I was like, okay, every other person is going to understand the context and we will put in the measures stated. But I was very shocked when I got to the market on Sunday, and then a lady was on call with her son. She was like, "Hello, Epie. Epie, see, na me I born you, Epie. Epie, some bad sick don't come out for Kumba. Epie, I know say you like woman, but Epie, I beg, no, they do this thing. I don't hear say this new sick way don't come out for Kumba, so you get them when you do chuku chuku, Epie, and when you get them, you go shit blood and you go piss blood." I was like, who gives you people this information? Where do you get your information from? Do you have a BBC or CNN, a CRT? Where do you people get your information from? Anyways, that's why I'm here. Ladies and gentlemen, I am MIE, the local community girl, and you're welcome to Feel Alive with MIE. Today, we are going to be discussing schistosomiasis, in other words, called bilharzia. So, what is schistosomiasis? Schistosomiasis or bilharzia is a parasitic infection. It is caused by a blood fluke flatworm, that is a group of organisms called schistosoma. There are different types. There is Mansoni, Hematobium, Intercalatum, Japonicum, etc., etc. Why is it very important that we get to have this discussion? It's because, firstly, 250 million people are affected by schistosomiasis. 800 million are at risk, and 85% of the affected population is sub-Saharan Africa. I am Africa. The majority of you listening and watching me are Africans, which automatically means we are at risk and we must have this discussion. All right, so how does schistosomiasis come about? Generally, schistosomiasis, I would say it's from two words: contaminated water. Yes, someone will ask me, MIE, how does the water get contaminated? Ideally, this is what happens. When you go to swim in rivers, streams, those of you who have made it in life, you go to beaches, you get in there and get the larva, or what we call, in simpler terms, the maggots of this schistosoma. When you get the maggots, what happens is they travel through your blood vessels, especially lung capillaries, and then they get to your liver. When they get to your liver, they grow or mature into male and female worms. These male and female worms are going to produce eggs. The eggs are then going to disseminate to your intestines, your urinary bladder. Then, when you eat corn chaff, when you eat eru, you will carry your head and go and stool. You defecate in a river. Yes, when you defecate in the river, you send out those eggs. Those eggs are going to be hosted in another host. And you know what this host is? It's a snail. Snail, nyamangoro, yes. So when it gets into that host, now the eggs hatch into the larva, then you pick it up. So I hope you've understood that these rivers get contaminated because you go and defecate, or you send out the eggs of the schistosoma back to the river. The eggs get to the snail, mature, and then you pick it up from there. Or they hatch, sorry, you pick it up from there. All right, now, after saying that little pathophysiology, which is not very important for my discussion right now, I want us to ask ourselves, who are the people at risk of this disease? The people at risk of this disease are people who practice poor hygiene and sanitation. You see, going to the river to defecate is the highest level of poor hygiene and sanitation. Yes, I said it. Secondly, fishermen and farmers who deal with these water bodies are at risk. Yes, they are at risk because they are exposed to the contaminated water. Children and adolescents, you see, children like us, we like to explore a lot. So when we are small, we like to go to Koke water, Bitingi water, to go and swim and catch fish. And then when we start growing big, what we call adolescents, we want to go to Sema and do livy-dovey. Yes, so children are also at risk. People who are immunocompromised are also at risk. What does it mean to be immunocompromised? It simply means that your system isn't as active as it was before to fight infections. So the slightest infections you get, they spread rapidly in your body compared to someone who actually has a better healthy system, or someone who is immunocompetent. Okay, I'm not saying that you who has an HIV or who has a cancer is already having a schistosomiasis. No, I'm simply saying that you are at risk. All right, so having said that, what are the clinical features of schistosomiasis? Now, to somebody who has never been exposed to schistosoma, like you've never had an encounter, you're going to have a rash called a swimmer's itch, which generally disappears 1 to 2 weeks. And then you're going to develop a fever 2 weeks to 3 months after exposure to the river or something. You're going to develop a fever. This fever is called a Katayama fever. Do you know the funny thing? This fever presents exactly like malaria. You will have the headache, the muscle pain, and then there is a fever there. Then you can have some little cough. And to those of you who are trained doctors of the Most High, you're going to get your anti-malaria medications. When you get your anti-malaria medications, even without you getting it, the fever is going to disappear within 1 to 2 weeks. The fever disappears. But when you take the anti-malaria, you think it's the reason why it disappeared. And then you're going to come back to the hospital 2 weeks or 10 weeks later with the real shege. And do you know what the real shege is? You're going to have bloody diarrhea. Remember I said that when this thing goes to the intestines. So you have bloody watery stool, you have bloody urine. This thing goes to the lungs, which means that you will come with difficulty in breathing. This thing accumulates in the liver, especially for children. They are going to come with enlarged abdomens, and you're going to carry the child to one uncle saying that no, it's konabele. Konabele killed there. I'm sorry. I'll still maintain professionalism. Well, it's not konabele. The child's liver is enlarged because of the disease. And one other thing that comes, which is rare, but it comes, is that you might wake up one day and discover that you can't walk again simply because this disease has migrated to your spinal cord and it affects both legs. So with the severity of this disease, what do you understand? If you have the slightest fever, come to the hospital. Do not auto medicate, because you might be treating the wrong thing and you will end up coming up with very, very serious complications which will be difficult to manage. How do we prevent this disease? It's obvious. Stay away from water. Stay away from contaminated water. You will ask MRE, how do we know the water is contaminated? Even me, I don't know, because I cannot see lava with my naked eye. So just stay away from water. The next thing is that practice safe hygiene. Yes, stop that nonsense of going to stool in the river. I know times are hard, right? But I think it's better to, I don't know, but just stop it. I don't know how you dispose your feces, but stop it. You're putting so many people at risk. And then generally practice good hygiene, as I said. And lastly, understand that this disease is treatable. So once you have the slightest discomfort, ensure to come to the hospital and we will do the right investigations, give you the right diagnosis, and you will get the right treatment for the disease. And the last of the last is that you should listen to health education talks. That is why you have MIE. I've told you follow me. I've told you subscribe. I've told you like, but you don't want to hear. Listen to health education talks that come from Feel Alive with MIE so that you will save your life. By the way, if this video is good, do well to like it, to share it, to subscribe, to follow, so that you stay updated whenever I have a new health talk to deliver. Thank you. Remember, this is MRE, your local community girl, and it was nice having you on Feel Alive with MRE. See you next time.